So today's episode is going to be slightly different from our conventional episodes, where I'm going to be talking about not the disease processes and the treatment plan, but I'm going to be talking about the new aspect and advent of artificial intelligence in dentistry. Now this has been relatively new, and it has been there all over the internet that artificial intelligence has come into the picture. Somewhere we know that there is flack about the fact that it's taking up jobs, but it's creating new jobs as well. You have so many softwares and algorithms. So let me talk about the application of artificial intelligence in dentistry. So the application of AI in dentistry is not new. We already have something known as intraoral scanners, and we have these softwares where we run algorithms to make sure that the simulation happens, especially in orthodontics when it talks about malalignment of teeth, and you do an intraoral scan and you can get the extrapolation of the results, and you can see the simulation of what the post-operative result might look like. On top of that, AI, when we talk about AI in general, we have something known as neural networks. So talking about AI, we know that the human brain is the most complex organ in the body, and it can think about itself, and it has these neurons and neuronal networks and all those things. And on the basis of that, because the basic function of the brain is to have an input, process it, and then proceed with an output. So AI also works on that. The primitive AI like machine learning also worked in that manner, where you had an input, you had a process, and then you have an output. But now AI is an umbrella term having a lot of things such as machine learning, deep learning, so many things, right? Language based computing, compact computing, so many things are there. So these things are again very vast when it comes to dentistry, but I'm just going to talk about the basic aspects of AI in dentistry. I've already spoken about the artificial intelligence of the fact that when you put in the algorithm of aligners and the aligning software, you can do a simulation. On top of that, we do have certain applications of AI in dentistry, such as pre-cancerous or cancer detection, because with the help of data and photographs, you can run them under the the machine learning and the deep learning, which is layered learning, and they can come up with responses as to how you can predict that someone might be having propensity towards developing oral cancer. However, this is in a nascent stage. When it comes to other models such as caries management, definitely we have X-ray models where we have diagnostic models, and thereby you can do early detection of proximal caries. In fact, even in periodontics, you have interdental bone loss, which can be predicted for later further bone loss, and the fact that it could help in guide the prognosis of a hopeless tooth for the future. Now, when it comes to other fields, definitely you have oral and maxillofacial surgery, where robotics are already playing a lot of role in terms of AI, and other fields such as endodontics, where you have radiographic assistance such as 2D radiographs of IOPs and OPG. So running these X-rays through AI might help us find out curved canals, radix intermolaris, and all those other things, and which might give better prognostic results in terms of endodontic treatment. When it comes to other aspects, you definitely there are some softwares which help in, especially in patients who have lost their some sort of a maxillofacial part, and you have to fabricate a maxillofacial prosthesis, where you can run the algorithm of the photographic nature of the face and the ethnicity of the person with the age and everything, and the data points can help in reconstruction of that lost path with the help of the right functions and the aesthetics, and you can recreate those maxillofacial prosthetics. Mostly the application of AI is already there in very minuscule forms like scans and algorithms and data points. However, AI does have some limitations because of the fact that the data that we have right now is very heterogeneous. That means it's not very organized. I think with further studies and further improvements of collecting and standardizing the data to organize it, we will get better algorithms, we will get better data points for us to work and predict the nature of the diseases, predict the course of action. So this was today's episode. Please like, share, subscribe, and do press the bell icon button for important updates. Here are my social media handles. Drop me a message on WhatsApp. I don't charge any fees for any WhatsApp message, and you can drop me a message, and within a couple of days I'll get back to you. I do get back to my patients when they drop me a message, because I check my WhatsApp messages every day end. And I would request all of you to be patient when waiting for my reply. I might take a lot of time, might take a couple of days, so I would really request all of you to be patient. If you have any queries, apprehensions, doubts, or insights, please feel free to put them in the YouTube comment section. So that's it for today. Thank you.